Let me ask you something most men have experienced but rarely talk about. You're in an intimate moment, you're ready, mind engaged, body prepared, yet without warning, your erection begins to soften. You didn't change your mind and your attraction hasn't diminished. And the more you try to will it back, the worse things seem to get. Thoughts start racing, stress kicks in, and suddenly you're spiraling. This kind of experience can be confusing, even frustrating. But here's the truth, it's more common than you think, and more importantly, there's a way to take back control. As a medical doctor specializing in men's health, I want to show you a technique you can use anytime, quietly, quickly, and effectively, to restore firmness and confidence, right when you need it most. This might be the best video for men to see this year, because what I'm about to reveal is proven, and no doctor will tell you this much easily. Before we get into the method, understand this. If you're dealing with significant or chronic erectile dysfunction, such as that caused by advanced diabetes, serious cardiovascular disease, or a long-standing hormone imbalance like low testosterone, you'll likely require a comprehensive medical approach. No single trick will be a cure in such cases. That said, what I'm about to share with you is both a proven physiological technique and a powerful self-regulation strategy. It's grounded in the latest understanding of male sexual health, and it begins by recognizing that erections are not simply about desire. They are a direct reflection of blood flow, nerve activity, and muscular control at work. If you're generally healthy and your erections fail only occasionally, especially under stress or pressure, this technique can be a game changer. And even if you have more serious symptoms, this is still a fantastic foundational tool. Okay, let's talk about the real reason you clicked on this video, the technique. Why does it work and how should you do it? Erections are a cardiovascular and neurological event, not just a response to visual or mental arousal. Blood flow is everything. When it's strong and sustained, your erection follows suit. When interrupted, especially by anxiety or nervous energy, blood vessels constrict and performance falters. There are two main systems that control this. First, your autonomic nervous system, which regulates whether you're in a state of stress, fight or flight, or relaxation, rest and digest. The fight or flight state constricts blood vessels, diverting blood away from non-essential functions like sexual arousal. The second system is your pelvic floor musculature, a powerful group of deep muscles that act as a pump to enhance and maintain penile rigidity by helping trap blood in the erectile tissues. This technique harnesses both systems simultaneously, which is why it's so effective. What we're doing here is activating the parasympathetic nervous response through specialized breathing, literally calming the body and increasing nitric oxide, the molecule responsible for dilating blood vessels. Simultaneously, we engage the pelvic floor to mechanically push blood into the corpora cavernosa, the spongy erectile tissue of the penis. When those blood vessels are open and you're actively supporting circulation, you can achieve and maintain a firm erection, even under mild psychological pressure. Now, here's how to do it step by step. Step 1. Begin with a controlled nasal inhale. Breathe in deeply through your nose over 4 seconds. Aim to inflate your abdomen, not just your chest. This method of diaphragmatic breathing taps into the vagus nerve, down-regulates the stress response, and importantly, activates nitric oxide synthesis. Did you know your nasal passages are the body's largest reservoir of nitric oxide? That's why nasal breathing is critical. Step 2. Hold your breath for 2 seconds. This brief pause allows oxygen to fully saturate and elevates circulatory nitric oxide just slightly, enough to begin relaxing blood vessels. Step 3. Exhale slowly through the mouth for 6 to 8 seconds. This long exhale promotes a short, controlled hypoxic state. Why is that helpful? Research shows that mild hypoxia triggers a reflex surge in nitric oxide and stimulates a parasympathetic response. In plain terms, you start feeling calmer, more focused, and physiologically prepared for arousal. Step 4. Now, during this exhale, begin to gently contract your pelvic floor muscles. Think of the muscle you would use to stop urine midstream. That's your pubococcygeus, PC, and bulbocavernosus group. As you exhale, lift those muscles gently. Don't clench, just a subtle upward activation. You might feel a slight lift or strengthening sensation at the base of the penis. Hold this contraction for the entire exhale, 6 to 8 seconds. Step 5. Release. Relax your whole body. Let go of the tension in your pelvic floor, your chest, your jaw. Allow yourself to reset. Step 6. Repeat this entire breathing and muscle activation cycle 3 to 5 times. Each full cycle takes about 10 to 15 seconds, so you're only investing around a minute. And yet, in that short time, you're using 2 powerful and natural mechanisms, neurology and physiology, to restore performance. This technique harnesses both systems. Now here's what's happening under the surface. Your breathing pattern has shifted your autonomic system into parasympathetic mode, calming you and allowing for proper penile blood flow. Meanwhile, your pelvic floor squeeze is mimicking the action of the bulbocavernosus muscle, which typically acts to maintain intracavernosal pressure during erection. This layered approach, mechanical plus biochemical, is precisely why it works. And if you want to take it a step further, add just 10 quick squats or 10 push-ups before or after doing this cycle. Moving large muscle groups gets your heart rate up slightly and encourages peripheral circulation, driving more oxygenated blood toward the pelvis. You can do this discreetly before sex, during foreplay, or whenever you feel performance slipping. It's natural, effective, and rooted in both anatomical science and clinical evidence. Okay, so if you're ready to take ownership of your sexual health, not just react to problems, but actively prevent them, start with this technique. Then go further. Explore your nitric oxide levels, your cardiovascular fitness, your hormone status. All of these factors matter. And yes, nutrition plays a major role too. In fact, if you're serious about staying firm long-term, make sure to check out this next video where I'll walk you through 3 clinically proven foods that naturally elevate nitric oxide production and improve erectile function. You don't have to feel uncertain or frustrated anymore. You have options, and it starts by understanding how your body actually works. So if this video gave you even a spark of insight or hope, don't keep it to yourself. Believe me when I say there are millions of men silently struggling with the same challenges. Sharing this could be the lifeline someone else needs. And if you're ready to keep mastering your health, performance, and confidence from the inside out, make sure to hit that like button. It's a small action that tells the platform this content matters and helps us reach more men who need real, science-backed answers. Click subscribe and turn on your notifications because we're just getting started. I'm committed to bringing you cutting-edge strategies, hard truths, and powerful tools to help you take full ownership of your body and your vitality. Your health isn't just about survival, it's about thriving. Let's build that foundation together. You've got the tools, you've got the knowledge. Now take the action. See you in the next video.